Hello, my name is Dmitry Lysachev, and I'm a resident in the Department of Urology at the Moscow State University of Medicine and Dentistry. And thank you for the opportunity to share with you our thoughts of use of Ringer's solution for local anesthetic in outpatient administration of intradetrusor botulinum toxin A. None of our colleagues had a conflict of interest, and the study was self-funded. Botulinum toxin injections is a minimally invasive yet effective treatment for patients suffering from overactive bladder resistant to conventional therapy. The procedure can be performed in outpatient setting under local anesthesia, but it is associated with significant pain and discomfort. Because of its slightly more alkaline pH and mineral composition, we thought that Ringer's solution is capable to elevate pain perception threshold while being used as a bladder irrigation solution. The objective of current pilot study was to test out the anesthetic capability of Ringer's solution for intradetrusor botulinum toxin A injections. The 2016 article by Dressler and colleagues has further bolstered our beliefs in Ringer's solution for local anesthesia. 42 consecutive patients with the mean age of 64.2 years with no diagnosed diabetes or spinal cord injury underwent intradetrusor 100-unit Botox injections for non-neurogenic overactive bladder at a single-day department of our hospital in the time frame from February till December 2020. The patients were randomly assigned into control and Ringer's groups. Botox in both groups was prepared to the standard 100-unit reconstitution and dilution procedure with the use of normal saline solution and later injected at 10 sites using laboratory cystoscopy injection needle. After the procedure, each patient filled out a questionnaire and rated experienced pain and discomfort on a visual analog scale, adopted for Russian language, where 0 would be no pain at all and 10 most extreme pain and discomfort ever experienced. Prior to each procedure, an informed consent was obtained. We included patients with urodynamically confirmed overactive bladder refractory to conventional treatment, patients who had known diabetes or neurogenic conditions such as spinal cord injury or stroke, as well as patients who had chronic or acute renal disease, and patients who wanted to undergo botulinum toxin injections under general anesthesia. Those patients were excluded from the study. In comparison to control group, where Botox injections were performed under lidocaine and chlorhexidine containing gel, Stilagel, and normal saline irrigating solutions, patients in the Ringer group showed an improvement of visual analog scale by at least 2 or 3 points, with a mean score went from 7.1 to 5.1. Those 4 patients who underwent repetitive Botox injections noted that under Ringer solution, pain was more localized and momentary, and ultimately more tolerable in comparison to previous experience. Our initial study showed promising results, lowering pain threshold during the procedure. However, this study was not without its limitation. Patients of particular elder age may have altered bladder wall sensation due to neurogenic or diabetic tissue alterations. Few of our patients were thoroughly screened previously by neurologist or general practitioner. 2 of the patients even struggled to fill out the visual analog scale. The study was severely disrupted during 2020's COVID pandemic, since our department was repurposed for treating COVID patients. The use of Ringer's solution for bladder irrigation is a feasible way to reduce pain and discomfort for patients undergoing intradetrusor botulinum toxin A injection under local anesthesia for overactive bladder in outpatient setting. More widespread use of Ringer's solution as a local anesthetic irrigation media may allow to perform more procedures in outpatient settings, thereby minimizing associated costs, risks, and hospital resources, which tend to be vitally important during current COVID pandemic.